Are you still suffering from nagging hip or low back pain even though you try to stretch, exercise, and stay active? If so, you might want to keep watching. This video might be for you. Could be coming from the ground up, and your feet might be involved. Hi everyone, I'm Dr. Mark Pawicki here from Pawicki Physical Therapy in Duxbury, Massachusetts. I'm a doctor of physical therapy. I'm a holistic wellness and performance specialist. And basically what that means is I help people figure out what's going on in their body so they can feel their best, move their best, and perform at the highest level, no matter what age or activity level they're trying to do. I'd like to highlight a story of a patient of mine. Her name, we'll call her Colleen. It's not her real name. It was changed to protect her innocence, just to keep her confidentiality at bay. We're going to call her Colleen. Anyways, Colleen was a person that had nagging hip or low back pain. Colleen's story, 52-year-old woman, very active, enjoyed exercise and being active routinely, loved bike riding, going to the gym, walking. She wanted to transition from a walking program to a jogging program. And as she started ramping up her walking, her speed, duration, etc., and as she started introducing jogging, she began having more hip and low back pain. Colleen came to me when the pain basically became to the point that it was actually limiting her ability to progress. And, she went to her doctor, and her doctor basically said, try physical therapy. So when Colleen came to the evaluation, we basically looked her over. If you ever come into for an evaluation with me, basically when I say a holistic wellness and performance specialist, basically what I do is look at the whole person from head to toe, looking at their posture, looking at how their body works, because the thing that I do know is the body works its best when we're in basically our postural neutral, which is our most balanced position of our body. So when I looked at Colleen, we started at the ground. The first thing that I noticed is that she was overpronated in her right foot. So what does that mean? So first of all, people hear pronation and they think it's a bad thing. Pronation is actually normal. When our foot hits the ground, we actually hit on the outside of our foot. That's actually supination. And as our foot comes down, that's pronation. When our foot comes down but goes inward, that's excessive pronation. So that point at which basically your foot starts to go in beyond horizontal like this. And what that looks like as you put your foot down, okay, is you get, look from the side, the foot goes down, it causes my center of gravity to go forward because my arch is collapsing in and as I'm walking forward. The other thing that what happens is it creates an inward or an internal rotation at the knee, also at the hip, and this can create additional stress and strain on our bodies. When we looked at Colleen, she basically she had excessive pronation on both feet, but her right was worse. So what that caused her to do, so she was worse on the right. So to straighten out, so she basically, her center of gravity went forward like this and in, and she actually turned to the side like this. So basically she was more extended in her lumbar spine and compressed. Consequently, she had more right-sided low back pain. And in addition, she had a tight iliotibial band, IT band. The IT band is a secondary hip stabilizer. And when our center of gravity shifts anteriorly, our glutes, which are our primary hip stabilizers, don't really engage the right way. And our IT band tends to take over when that happens. When the IT band takes over, typically only bad things happen because the IT band usually creates tension in the hip and creates a lot of things that you hear our doctors say, from tendonitis, bursitis, etc. Basically just additional compression and strain on the hip, which is not a good thing. In addition, looking at Colleen, we analyzed her overall posture, And what we tried to do first, number one, was just educate her on what was neutral posture. Neutral posture being head, over your shoulders, making sure you're neither flexed or extended, and what that looked like and felt like. How to engage her core. We made sure that her hips were basically leveled, that they weren't tilted forward, which is this way, which creates that kind of extension and pinching in the lumbar spine. But we also don't want her rotated posteriorly, which is what I call the Pee Wee Herman, which is that kind of slouch where you're kind of sitting back like that. And then, even though her feet were excessively pronated, we tried to get her to focus on keeping her weight through her heels, so she could stay grounded through her heels. I don't like my patients to actually roll their feet to the outside. Rolling your feet to the outside is basically our body's way of subconsciously trying to create our own arch, which sounds good in theory, but a lot of my patients that try to create their own arch end up spraining their ankles, which is actually kind of it's kind of ironic, because when people are overpronators, they cave in this way, try to create their own arch, and then they end up rolling their ankles to the outside. So we don't want that to happen. Long and the short of it is, what we did with Colleen is I did a taping procedure, which basically created it didn't create an arch. It basically assisted or supported her arches. We taped both of her feet, her right and her left. Basically, what I was looking for is to create a situation where when she stood, she was able to maintain her neutral foot position. The whole idea about orthotics, what they do, they get a bad rap when they're not made appropriately. If orthotics aren't made for you, your body weight, your feet, and your foot flexibility, they may or may not be doing what they're supposed to. I can't even tell you, I've had hundreds of patients come into me and say, "Oh, orthotics don't work. I've tried them, they don't work." They have to be made the right way, and they need to be made by somebody. Just because they're made by a chiropractor, podiatrist, or even a physical therapist for that matter, but you need to know somebody that knows how to assess if they're truly made for you. And which I've been doing these for over 20 years and have had great success. The other thing, quick side note, all orthotics, again, aren't the same. If you're going to go or try an arch support off the shelf, or go to the Good Feet store where they say they have custom orthotics, Good Feet store is not custom orthotics. You're spending a lot of money for something that's not really made for you. They're trying to take models off their shelves and make them kind of retrofit your foot, your body, but that's not the best way to make orthotics. Needless to say, if you have any more questions about orthotics, come in for the free consultation. I'll go over all that with you and talk about it. The bottom line is, back to Colleen, when we had Colleen taped, she was much better able to maintain her neutral posture and center of gravity. Well, what did that mean? Well, what it meant was she was, standing was easier, moving was easier. She didn't have to stretch as much, noticed a lot less tightness. Most importantly, she noticed less pain. She was able to start ramping up her exercise and activity level. She started jogging, a little bit with the tape. She wanted to see, before she made the investment in orthotics, she wanted to see if she was able to run. And Colleen was able to do, from not being able to really run at all, was able to run 1.5 miles, basically without any hip or low back pain, which she was ecstatic. So, I felt comfortable at that point saying, "You know what, Colleen, look, if you like the tape's going to loosen. Orthotics are made for you if they're made the right way. Sky's the limit for you. I think it can really help your running." Needless to say, we were able to make Colleen custom orthotics. She got into running. She currently is able to, she runs between 3 to 5 miles at a time, 2 to 3 days a week. She's ecstatic. She's basically living her best life. And most importantly, not only is she not in pain, she feels better. She feels the benefit of the exercises she's doing versus before, being the more she exercised, the worse she felt, which is kind of the opposite of what we want as far as wellness goes. So Colleen, it was definitely a happy story. More importantly, though, Colleen, with the help of the orthotics, we also gave her the education of what she needed to do with the orthotics. Orthotics by themselves aren't going to correct everything. What makes the difference for people is a holistic approach, and I spend a lot of time trying to educate my patients so they know what they need to do for their body to keep it healthy and to function at the highest level. And never mind being in pain. My goal is to get them to function at the highest level and not, I don't like them, my patients, to want to wait until there's pain. In other words, if you're able to know where your body should be, you can make corrections or do stretches or adjust things in how you're standing, sitting, in your posture, etc., to kind of ward off any potential stresses or strains on the body that might be causing pain. And that's really kind of the benefit of working with somebody that has that approach, that number one is going to spend the time to give you the tools to understand your body so you can be successful. And then, obviously you do too much, then you can come back and see me if you need a tune-up, et cetera, et cetera. So the bottom line is this: if you're 45 years old and you're active and you're still fighting hip or low back pain, let's find out if your feet are part of the problem. You can book a free consult today with me. You can do so by calling my phone, 781-820-0759. That's 781-820-0759. Or you can go to my website, Powicki, P as in Peter, Powicki, powickipt.com. Book a free consultation. Come in. There's no pressure. I do a taping which mimics what an arch support's going to do for you. What it's going to do, what it's going to simulate. If it can help you, you're going to tell me that it's not a high pressure sale. It's basically you feel better. You tell me how it helps. If you think it's a coincidence, I'll have you come back again. We can try it again. There's no peer pressure. All I want from my patients is to have success. And more important, I think it's more important for my patients to have the awareness and the ability and confidence that they know what they need to do to stay healthy for the most part. My basic mantra with my patients is, I want you to be able to handle 80% of your life, meaning that you can handle 80% of what you need to do. Now, that means, God forbid, if you're overtraining or you're rear-ended in a car accident, you slip on leaves or you slip on ice, again, hopefully that never happens, but if it does, it doesn't matter how aware you are of your body. I mean, accidents happen, unfortunately. But if they do, you've got somewhere to go and someone that's going to give you real information. But most importantly, my job is to educate you to be the best version of you so you can live better, feel better, and move your best at whatever age. So if you're interested in coming in, book your free consult. In the meantime, I hope everyone stays healthy and happy. And in the meantime, be great. I look forward to meeting you.